Hello, good afternoon, good morning to those of us in the Northern Hemisphere, and welcome to Best Practices in Mentoring for AGYW HIV Prevention Programming webinar hosted by Genesis Analytics. My name is Adjoa Kwarteng, and today I'll be chairing this very exciting event. So just to tell you a little bit about myself, I am a manager here at Genesis Analytics. I've been working in the consulting firm for 3 years. In terms of my academic background, I have an MPH in health policy and management, and I specialize in program management, change management, and capacity building within public health programs with experience in maternal health, human resources for health, and more recently, HIV prevention. So now that I've introduced myself, I would like to know a little bit more about everyone as well. So may I please ask all attendees to please put your name, organization, and location into the chat function. So before we get started, I wanted to just first thank the funders of this webinar, the Bill and Melinda Gates Foundation, and in particular, Senior Program Officer Siobhan Malone. On behalf of Genesis Analytics, I also like to thank PEPFAR and Global Fund colleagues who were especially supportive as we did our own mentoring for AGYW HIV prevention evaluation that we'll be talking about in a few minutes. I would also want to thank in advance all the speakers today who so generously volunteered their time to share their experiences on the ground with all of us. Finally, I would love to spend some time to thank all the participants who are joining this call now for your time and for engaging in a very meaningful and respectful way around this very interesting topic. And we hope that together we are going to learn from each other and help reduce the risk of HIV infection amongst this very vulnerable population. So just an FYI, there is interpreter services available on this webinar. And if you click the icon that says interpretation, you'll be able to access the webinar in your preferred language. Next slide, please. So I'm going to just run through the agenda very quickly so that we know what's in store for us. So first of all, we will be doing the welcome introductions and house rules, which I'll take you through just quickly in a second. Then we'll be having some opening remarks from Thobeka Mvuna from TBHIVCare. And then we'll have our first round of presentations, first from Genesis Analytics and Robin Mohr, as well as people from the London School of Hygiene and Tropical Medicine, Pop Council, and Final Mile. Then we'll take a break and have a short Q&A session related to those particular presentations. After that, we'll have a second round of presentations, which will focus on mentoring promising practices. And those will be done by colleagues from the Henry Jackson Foundation in Tanzania, as well as RICAP Zambia. Then we'll have a second round of Q&A before we hand over to Kaya Lewis Atkins from the Global Fund. So next, I'm just going to walk you through some very quick house rules so that we are able to ensure that this program runs very smoothly and timelessly. Allison, next slide, please. Oh, okay. Actually, before we get to that, I wanted to make this a little more interactive, a little more interesting. So what we're going to do is we're going to put this link in the chat function very shortly. And then I want everyone on the call to just take a moment and reflect on how you describe a mentor in AGYW HIV prevention programming and put that word into the Mentimeter in the link that is going to be sent to you right now. So maybe take a minute to reflect and then put that word down. Not in the chat box, just an FYI, please click the link that's in the chat. It says it's from Karabos Kozana, and please put the word in that instead. Thank you in advance. Okay, I hope that everybody has had a chance to make their submissions, and we look forward to reading about what you think a mentor is and how you best describe a mentor at the end of this webinar. So now I'm just going to go into the house rules, just so that we know that what to expect and what to expect from each other. Next slide, sorry. So before we get to our first speaker, I just want to remind everyone on the call to please try and stay muted when you join the session, and that when we whilst the presentations are going on and you have any questions, please make use of the Q&A function within the Zoom and put your questions there. There are moderators on the call who would identify who those questions need to be sent to, and then we would then during the Q&A session have the speakers respond to your questions. Also, when we get to Q&A sessions, you do have the opportunity to actually ask your questions verbally, and to do that, please just raise your hand so that we can identify you, and then you can go ahead and ask any questions that you want to do. The last point I want to make is that this session is actually being recorded for the benefit of people who are not able to attend the session. And this recording will also be made available to all of you at the end of this webinar. So with that being said, I'm going to introduce our first speaker, who is going to give us the opening remarks. Her name is Thobeka Mvuna, who is a mentor at TBHIVCare based in Durban. So just to give you a little overview of who Thobeka is, prior to her work at TBHIVCare, she used to tutor high school kids at Isibani Youth Center. She then participated in TBHIVCare's HIV prevention program, and over time became a mentor as her interest in helping young people develop themselves and lead HIV-free lives grew. So over to you, Thobeka. I think you're on mute. Unmute yourself.
Hey, unmuted. Greetings, everyone. It's such a privilege and an honor to be able to share my experience, my mentorship experience with everyone today. So how I became a mentor is that the TBHIVCare facilitators and nurses recognized that I was interested with working with young people and had a positive attitude. I then graduated from the structural programs. Following that, I was offered a role to become a mentor by TBHIVCare. What I do as a mentor is that I recruit vulnerable and non-vulnerable adolescents, mostly girls, to participate in structural programs. I go to places where young people congregate after school, and I invite them to participate in our structural programs. Where are these places? These places are parks, playgrounds, shops, Wi-Fi spots, libraries, schools, and churches. I create a safe space for groups where I divide them into their age groups. I divide the 10 to 14-year-olds, 15 to 19s, and the 20 to 24-year-olds. These safe spaces are often schools, community halls, or libraries. I take one group at a time through different sessions, and to date, I think I've done or mentored approximately 30 group sessions. What I do as a mentor is I help build a supportive social network for the participants. I build a relationship with these AGYWs. I provide them with information about HIV and AIDS, gender-based violence, sexual and reproductive health, and also distribute and demonstrate condoms and lubricants. I build refusal skills and negotiation skills among these participants, because I want these young girls to be able to grow up and speak for themselves, to be able to voice themselves and be able to say no when they mean no. I champion issues at family and societal levels. I then, when we are done with structural programs, link my participants to health services that we provide at TBHIVCare, which is HIV counseling and testing services, family planning, PrEP, STI screening, and psychosocial support. How this makes a difference in our communities is that through Isibani Center, where I volunteered, I did sessions with matriculants, and I also helped them fill university application forms. I used laptops to help them apply for funding, and I'm proud to say about 15 of these matriculants are in varsity now. Besides me helping them in groups, but I also contribute to them individually. There's this young girl who was able to open up to me, and I was the first one she opened up to, and she told me about how she was being sexually abused by a church leader. And throughout the sessions, I did notice that she had her wrist cut. I was able to take her case further and referred it to our social workers at TBHIVCare. And now she's in much better space, and I'm still able to support her. I'm still getting positive feedback as we are peer mentors. I'll just read one message from one of my participants. It goes like, "Hey Thobeka, I will now help other young girls in my community through sharing health information and linking them to health services." So we are getting really good feedback around our structural sessions. How being a mentor has benefited me is that mentoring has given me an opportunity to give back to the community even where I come from. And also I'm learning from these young girls. I have gained personal satisfaction from contributing and changing lives of these young people. They are so important to us. My self-confidence and communication skills have greatly improved. I also realized that my facilitation and leadership skills have sharpened. Lastly, I'll just share about my future plans. I studied financial management at college, but now ever since I started being a mentor at TBHIVCare, I've realized that I'm really passionate with working with people or working with young people. So now I'm thinking of furthering my studies at studying social work part-time. Thank you.
Thank you very much, Thobeka. Very inspiring. So we are going to go to our first set of presentations. This will be done by Allison Pieterse from Genesis Analytics and Robin Mohr from Gillick and Mohr Consulting. So Allison is an associate in the health practice at Genesis Analytics and has worked on AGYW mentoring related work for the past 2 years. Robin is an experienced program manager with over a decade of work in global health, having managed a diverse range of programs and projects. She began her global health career at the University of Washington's Center for AIDS Research, where she focused on HIV clinical research and developed a passion for HIV care and prevention. Allison, Robin, over to you.
Thank you so much. Hi everyone, I'm Robin Mohr, and I'm happy to be kicking off this panelist portion of the webinar to talk a little bit about an environmental scan that Genesis Analytics and myself conducted in 2020. So this environmental scan, the goal was to take a look at mentoring in Global Fund and PEPFAR Dreams programs and try to better understand the way in which mentors are utilized by these programs. In particular, this scan focused on how mentors are recruited, trained, and supervised, also their career trajectory after they leave the program. And just what best practices we could glean by our conversations with staff, mentors, and mentees in these programs. As you can see from this slide, we had 10 objectives to our project. For today, for the purposes of this webinar and also for the sake of time, we will just be focusing on the first 2 objectives. I'll speak to the first objectives, and then Allison will speak to the second. Next slide. Great, thank you. So our project included a thorough literature review as well as deep dives in 5 countries. So South Africa, Mozambique, Zambia, Zimbabwe, and Namibia. So these interviews included in-depth interviews with the mentors, the mentees, and also staff from Dreams and Implementing Partners and Global Fund subrecipients. We also tried purposely to get a mix of urban and rural programs, and you can see here in the second column a list of the programs that we conducted our interviews with. Great. Okay, next slide. So objective number 1, what is meant by mentoring? With the first exercise we had you do and put in some descriptives of mentoring, most of us have an idea of what we think mentoring is, and what it might mean in a program. What we found through beginning with a literature review, that there's no universally accepted definition of mentoring. Although it is used in several settings outside of HIV, you might be familiar with some programs like Big Brothers, Big Sisters. That's one that comes to mind. But what it actually does and provides, there was no clear consensus. So we've included a few definitions that we found here, but one thing to note that we kept seeing over and over again in the literature review and then subsequently in our interviews, that there's key principles to mentoring. 1, experience, 2, guidance, and 3, trust. And what that means basically is that with experience, the mentor has a level of experience that is at a higher level than the mentee and can provide guidance and help to that mentee, whether that's through the mentor's own experience or their education. But there is that gap in between what the mentor has in terms of the experience and education to the mentee. 2 is guidance. So it's really important that the mentor is able to provide the mentee with guidance. That can run the gamut of several things. If we're looking at HIV prevention and in connection to services, or we're looking at something like Big Brothers and Big Sisters, where there's an ongoing relationship that can encompass a wide variety of services. So I want to really highlight also the trust aspect between the mentor and the mentee. So the mentee needs to feel that they can speak freely with the mentor, that they can talk about things that are going on in their lives and be in a safe place. Not on this list, but alluded to, and in particular, the first definition here is that this experience and relationship happens over a period of time. As we know, maybe in our personal life, that trust does not happen automatically in our relationships, and the same is true in the mentor-mentee relationship, that it really builds over time, and it's a key to a successful mentor and mentee relationship. Okay, next slide. And so while we honed in a little bit on what it meant to be a mentor, and decided that there were those key themes that really connected mentors and mentees together, we found in our interviews it was difficult for staff, mentors, and mentees to actually articulate how the mentoring program connected to the overall goals of the Dreams and Global Fund programs. We've included a couple quotes here that I think are really helpful that highlight that these programs are very much seen as beneficial to both the mentors and the mentees. But articulating again that linkage to the overall goals was less clear. But it's good to highlight here that while that may not have been easy for these staff to clearly articulate, these AGYW and these programs had articulated that they were much better equipped to make decisions regarding the sexual health, that they had increased awareness to services and support to getting to those services, and felt more empowered by the relationships that they had built. Next slide. And this is my last slide, and I know I'm running a bit out of time, so I'll go quickly. This is just to show that when we talked to the mentors in the different countries and the different programs, the terminology to describe a mentor varied widely. You can see here it goes from economic strengthening facilitators to dreams ambassadors to peer educators. And the responsibilities among these mentors varied as well. So like a community care worker had the task of linking the adolescent girls and young women to services, or a peer educator was there just to really provide us that curriculum. So it led us to talk about these mentors in a different terminology as a mentor-like cadre with different characteristics. So with that, I'm going to lead that to Allison to talk about what characteristics we found when we looked at mentors in these programs.
Thanks, Robin. Okay, so as Robin mentioned, the second objective of our work really focused on understanding the general characteristics of mentor. These included factors such as their age, sex, soft skills, technical skills, as well as their background. What we found was that mentors were generally female over the age of 18 and came from the same communities as the beneficiaries that they helped through the program. Their soft skills usually included good communication, being trustworthy, good listening skills, being passionate, approachable, and non-judgmental, as well as being a valued member of the community. While there was more of an emphasis placed on the soft skills versus the technical skills were considered to be a great advantage to the mentors. Some of the technical skills included knowledge on sexual and reproductive health, HIV, facilitation skills, as well as previous experience with adolescent girls and young women, as well as orphans and vulnerable children. One thing to note is that there was a special emphasis placed on the age of mentors. Generally, mentors were required to be considered as near peers, and what this meant was that the mentor was young enough to be able to relate to the mentees, but still old enough to be seen as a role model to the mentees or the AGYW that they work with. Given this requirement, we found that programs were often linking the mentors and the AGYW by their age groups and ensuring coherence in this manner. Some of the mentees that we spoke to noted that they didn't really mind the age difference if their mentor was quite older than themselves. However, other mentees felt a bit uncomfortable speaking to someone who was much older than them because it made them feel as if they were speaking to their mother or another relative. It was also noted that having an older mentor sometimes came with perks, as the older mentors were considered to be more trustworthy and also had more life experience, making them more suited to guide the AGYW. Also related to the age of the mentor was their ability to act as a role model, as well as someone who is relatable to the AGYW. There was this tension that we observed between between relatability and role modeling in mentoring. And the programs tried to ensure that they had mentors who could get a balance between being both a role model as well as being relatable to the mentees. An example of this was found in a case study that we did in Mozambique, where some of the mentors were defined as on-track girls. What an on-track girl was, is that this was someone who had never contracted HIV, who had never fallen pregnant, and was kind of on the straight and narrow path. And while someone like that is seen to be a great role model, they were not considered to be very relatable to the AGYW, because there may be AGYW who do have HIV or have fallen pregnant. And so mentees noted that they really did prefer to have mentors who they can see themselves in, someone that they can aspire to be like. However, the person still needed to be someone that was relatable, they could see themselves in her, essentially. So the results from the first objective showed that there was really this lack of understanding in terms of who and what a mentor was. We saw that there were all these different definitions and cadres used to define roles that we would typically align with a mentor. The second objective again showed us or provided us with some insights into the characteristics of who a mentor is why they are female, for example, or over the age of 18, and all of those types of characteristics, as well as why these traits are necessary for the mentors to effectively engage with the AGYW. From this work, we have developed a theory of change specifically for mentoring to show how the direct inputs of mentors would bring about intermediate outcomes that ultimately lead to a reduction of HIV infection rates amongst AGYWs through these programs. I'm going to try and go through the slide relatively quickly, but basically this slide is our theory of change that we developed from this work. It's focused on mentoring and starts off with the inputs that one would need or that a program would need to develop mentors who are committed, skilled, and experienced. So we speak about the fact that programs need to identify and recruit female near peers who are like the AGYW that they work with. These mentors then need to be trained and upskilled to develop the objectives of the program. The roles and responsibilities of these mentors need to be clearly defined. They need to be provided with feedback and supervision. They need to be compensated appropriately, and there needs to be a career progression plan and development for these mentors. Once all of these inputs are together, they create these mentors who are committed, skilled, and experienced. These mentors then undertake particular roles which lead to AGYW gains, such as an increased knowledge of HIV, an enhanced perception of HIV risk, improvement of self-efficacy, and increased empowerment and an agency for the AGYW. All of these gains allow the AGYW to make better decisions for their health. These gains also lead to outcomes such as improvements in economic empowerment, increased AGYW practicing safe sex, increased use of condoms and other products, as well as reductions in unplanned pregnancy and sexual and gender-based violence. All of these outcomes then lead to the overall impact, which is to reduce HIV infection amongst AGYW and mentors themselves. So essentially what this theory of change aims to do is really to understand, we start with these mentors, what is it that we need to give them to ensure that they are committed, skilled, and experienced? How does that translate into the roles that they play? How does that role facilitate AGYW gains? And essentially those gains then lead to the overall impact which these HIV programs are trying to achieve. Thank you very much.
Thank you so much, Allison and Robin. I especially love how well laid out the theory of change was. So next up is Isolde Birdthistle and Madeline Ireland from the London School of Hygiene and Tropical Medicine. So Isolde Birdthistle is currently an associate professor of adolescent health and epidemiology at the London School of Hygiene and Tropical Medicine. Isolde has previously worked in adolescent health promotion programs with the WHO, UNICEF, Harvard School of Public Health, and the MIT Media Lab. Madeline has worked with Isolde on the DREAMS impact evaluation. Madeline's role involved deep data analysis and synthesis of the results of this evaluation with the London School of Hygiene and Tropical Medicine team, which the London School of Hygiene and Tropical Medicine team will be sharing in the webinar today. So over to you, Isolde and Madeline.
Thank you so much to Genesis for inviting us to share findings on mentorship through our independent evaluation of DREAMS. We've been evaluating the impact of DREAMS in 4 settings in Kenya, South Africa, and Zimbabwe. And in the 2 Kenyan settings on the left here, those are the informal settlement areas of Nairobi on the top and a rural sub-county near Lake Victoria in Western Kenya. We are evaluating DREAMS through the end of this year, 2022. That's led by our partners APHRC and KEMRI. Next slide, please. So since 2016, together with APHRC and KEMRI, we've been gathering evidence along this causal pathway to understand the DREAMS package, what was delivered exactly and how and what was received, and what were the impacts of that on psychosocial mediators like self-efficacy and social support, and subsequently on outcomes that are related to HIV risk, and more directly HIV risk itself through direct observation of HIV incidents in rural Kenya. Next slide, please. By 2018 and 2019, we found very encouraging impacts of dreams on a range of outcomes, like circled top left there, knowledge of HIV status, quite consistent and high impact of dreams on that. And also on the right, a consistent and significant impact of dreams on social support in the 2 Kenyan settings. But we didn't find the same impacts everywhere that we did evaluate dreams. And we're trying to understand that heterogeneity by exploring how implementation and context influence impact. Next slide, please. So to help with that question, we have a range of process evaluation data. This is an example of the data collected in Nairobi by Pieterse. And these help us to understand how dreams was implemented in each context. And these data include focus group discussions conducted annually with mentors in Kenya. And these are very rich and candid discussions. They revealed the very critical role that mentors played in the delivery of dreams in Kenya. They were quite instrumental to the model of dreams in Kenya, particularly in the layering of interventions into packages. And so I'll turn it over to Maddie, who has analyzed these data in depth, to share her findings of those analyses. Thanks, Madeline.
Hi, everyone. I'm Madeline, Ireland, and as Isolde mentioned, I'll be kind of discussing the lessons learned in the Nairobi-based Dreams program that stemmed from my MSc thesis at the London School of Hygiene and Tropical Medicine. And I specifically looked into a thematic analysis to explore and strengthen mentor-led approaches to decentralize sexual and reproductive health services for adolescent girls and young women through dreams and informal settlements in Nairobi. Next slide, please. For the methodology and results, this was a secondary data analysis of the dreams impact evaluation qualitative data in Nairobi from 2017 to 2019. And you can see the list of data on the right-hand side. I used an inductive approach to thematic analysis, which resulted in the 6 overarching themes seen below. And the qualitative evidence found that mentors largely increased access to services. They created support networks, and they were really key in linking the dreams, adolescent girls and young women to resources, education, and more. And there was a lot of support that was offered to adolescent girls and young women recipients of the Nairobi-based Dreams program, but unfortunately, mentors were not supported to the same extent, despite being young urban girls and women of similar ages and from the same communities. So how did mentorship in the Nairobi-based Dreams program help to support adolescent girl and young women recipients? Through the 2 themes seen below, through use of safe spaces and access to services, mentorship was largely successful at integrating services in a comprehensive package through a closed circuit referral system by the layering that is so essential to the Dreams program. It helped mentees navigate services and link them to non-judgmental services. It created safe environments for recipients of the program through safe spaces. It improved decentralized services by offering a range of interventions in private safe spaces, providing HIV testing, family planning, PrEP counseling, and more. And it improved access to demedicalized services by trying to address the holistic needs of the adolescent girl and young women beneficiaries and helping to boost their protective assets and create a social safety network, which would potentially have, which would have the potential to reduce risk and the need of clinical services. The diagram on the top I created as a part of my thesis, which kind of explains the flow of the referral closed circuit referral system within the Dreams program that I saw. So as you can see, the mentee in need of specific services went to either mentors or the Dreams implementation office to be further referred to service providers, in which there was a system in which there was no loss to follow or limited loss to follow up with the support of that referral pathway. Next slide, please. And then the challenges that mentors faced in the Nairobi-based Dreams program largely were the remaining 4 themes, which were the responsibilities and time commitments of mentors. Mentors reported widespread responsibilities going far beyond the listed responsibilities in the PEPFAR COP 2021 document. They were on call consistently. They were reached out to in the middle of the night, later in the day, early in the morning, and they provided intense emotional, physical, and financial support to their mentees. Additionally, the perception of the roles of mentors often were conflicting, where they described themselves as having many different roles throughout the Dreams program in Nairobi. Additionally, there was conflict challenges. So there were some financial challenges where mentors reported financially providing for their mentees in times of distress, either through money or through providing housing or food. There's parental partner conflicts where mentors did feel threatened at times from family members of AGYW recipients or partners. There's conflicts with implementing partners where mentors didn't always feel respected by them. There were some security concerns when mentors were out in the community, and there was some myths and gossip that created challenges within the program. Last but not least, there was also some programmatic challenges. Mentors expressed every year and in both sites in Nairobi that they did not feel as though they were being paid adequately. Mentors also expressed a desire to be given a refresh on skills in the form of trainings. Mentors also expressed challenges with the Dreams manual, in which some decided not to bring the manual to sessions and instead supplemented the meetings with their own activities. And lastly, mentor characteristics. As this was kind of discussed in the presentation previously, some mentors were assigned to teach mentee groups that they did not share the same similar characteristics with. And kind of elaborating a little bit more on the perceived role of mentors with one of the challenges. This diagram shows how mentors describe themselves in the Nairobi-based Dreams program. And I'll just highlight 2 of the quotes. On the left-hand side, the parent quote, one mentor in 2019 said, "I want to mention the negative effect. There are some parents who have given us their child, and we have become like the parents of that child. And this is a big challenge, and I can't say it's a positive thing." And then on the right-hand side, directly across, there's a quote from a mentor describing themselves as a sister, saying, "We don't really relate to them as teachers, but we act as their sisters. And we also have the same experience since we live in the same area. And their social asset building attendance depends on how we relate and handle to them." So as you can see, there's a wide range of different conflicting roles. Next slide, please. And then in order to really elevate mentors' voices within this presentation, there was some lack of communication with implementing partners, where implementing partners generally spoke of mentors being essential to the program, but in the same exact year and the same exact site, mentors themselves reported limited opportunities to give feedback to the implementers. And as you can see on the quote on the left-hand side, one mentor expressed that implementing partners just come up with plans for the whole year, those plans which don't have our thoughts, and they know we are the ones who do most of the things since we are in the ground. So we feel it would be better if we could have given them our thoughts rather than putting pressure on us in the last minute. And similarly, on the quote on the right-hand side, mentors expressed limited opportunities to fill vacancy positions and felt as though implementing partners took facilitators from outside of the Dreams program instead of upgrading them. Also, mentors' voices on their thoughts on trainings. Mentors expressed that they wish that they had more access to trainings. On the left-hand side, one mentor in 2017 expressed that mentoring wasn't enough and that they only had a 1-week training. So he said, as you could imagine, a 1-week training of mentoring is a wide thing, and we need more training. And they suggested that they need counseling skills, many skills, so that when the girls come with anything for counseling, they're ready. If it is interventions, the mentors, they don't have those skills and they still feel as though they need more. And lastly, she said, as she has also said about outside training, it's a good thing because as we are mentoring others, we also need to be mentored. And then in the slide or in the quote on the right-hand side, you can see that it kind of expressed one mentor in 2018 expressing she had not been trained since 2016. Next slide, please. And then finally, kind of expressing some of the large overarching responsibilities that mentors had within the DREAMS program. One mentor in 2018 expressed some of the challenges that came with it. And she said there was one girl who was raped in the midnight and she called me. So I had to connect ambulance to fetch her. And she did this because of her trust to me. There are also cases of rape. And there was a time we had a case whereby one of our DREAMS girls was suspecting that her child had been raped. There are some who tell us to buy food for them so that they cannot go without food and we have to help them. Also on the bottom right quote, one mentor expressed how some parents even go to the adolescent girl and young women mentors, where some parents can tell us their problems and we help them. I've grown as a mentor and now I know how to handle stress. So this mentor not only was assisting her mentee, but the parents of her mentee with their challenges as well. Next slide, please. So for the conclusion, for the future of mentorship in adolescent girl and young women HIV prevention programs, it's really essential that mentorship's able to be established as a valid career path, as this will ensure safeguarding, proper compensation, boundaries, increased training, increased respect for mentors, upward career mobility and opportunities for mentors. And then finally, as a true positive, a win-win for empowerment of both the mentors and the clients. And lastly, thank you to all the young women who participated, all of the data collection teams, and all of our colleagues. Thank you.
Great. Thank you very much, Isolde and Madeline. The challenges you've raised, I think, are definitely food for thoughts and present opportunities for collaborative joint problem solving. So definitely looking forward to see what comes out of these discussions. All right, so next up we have Miriam Temin from the Population Council. So Miriam leads Population Council's initiatives to promote evidence-informed, girl-centered programming using technical assistance, capacity strengthening, and evidence synthesis. Miriam strengthened the capacity of implementing partners under the DREAMS partnership, and she now uses these lessons in her work on the World Bank's SWEDD initiative to reduce child marriage and other risk factors for adolescents in the Sahel region. Miriam, over to you.
Great, thank you very much for the introduction, and thanks to the panelists for providing this opportunity for the Population Council to talk about what we have learned about sustainability of mentoring within adolescent girl programming. Next slide, please. I'm going to use this time to briefly clarify key concepts. What do we mean when we say group-based mentoring? What do we mean when we talk about sustainability? And then importantly, to share some lessons learned to promote sustainability based on our experience and our research, and then to share a couple of case studies with you in Guatemala, Abriendo Oportunidades, and in Rwanda, the 12+ program. Next slide, please. What is the source of the insights, evidence, and lessons I'm going to be sharing with you? The Population Council has been testing and refining approaches in service of adolescent girls for well over the past decade. You can see here on the slide some of the sites, and as you can see, many DREAMS countries there. We could also update this to include more DREAMS countries, for example, Cote d'Ivoire, where we're also working. And these have been studies and programs to explore implementation issues to reduce HIV risk, as well as other risks such as child marriage, early unwanted pregnancy, and school dropout. Now, one major lesson that we have learned across this experience with breadth across regions is that mentors are absolutely critical to program success. So really, we have learned that the success of these girl-centered group programs really rises and falls with the mentors. And we are very pleased that mentors are now getting more attention, as this panel and the very large group of participants is testament to. Next slide, please. Very briefly, what are we talking about when we talk about group-based mentoring for girls? Many of these points have been raised already, so I'll go quite quickly. Mentors in the model that we've been testing and refining, they're slightly older than groups, than the AGYW in the groups. They are from the community, they are capacitated or trained, and these are not aunties, these are not mothers or relatives. They are trained to serve in their function, and they are in the model as similar to the AGYW and the groups as possible. Mentors are made, not found, meaning they are not the elites in the community. They're not the atypical norm busters. They are young women who show the potential and experience to gain and partake knowledge in fun and participatory ways, demonstrate empathy, and that they have progressive attitudes about gender. The group aspect is vital. We're not talking about a one-on-one mentor model. For example, Big Brothers, Big Sisters was mentioned, but in this model, the group aspect is part of the mechanism of action. So this is very much consistent with what has been happening in the social asset building under DREAMS, and the creation of social capital, bonding capital within the group and between group members and mentors, and between the mentors themselves is actually one of the benefits of this model of programming. And we've heard about how mentors serve as role models and can create aspirations. And these are mechanisms by which they help to achieve outcomes that we saw in that very interesting theory of change that was presented earlier. Now, in some settings, in some contexts, mentors are actually explicitly serving as agents of change within their communities to disrupt and change social norms. That's not the case everywhere, but they do often provide whether an explicit or an implicit function of changing social norms. Next slide, please. In terms of sustainability, unfortunately, we're not talking about the role of mentors in solar energy or conservation, though we could talk about that in another session. What we're talking about is two different types of sustainability: sustaining a program whereby mentors are retained and that programming is able to go on with the cadre that has been trained, which is really a requirement for expanding and scaling up programming. But importantly, we have learned that it is very important to view the group of mentors as a beneficiary group. So beneficiaries of these programs are not just the girls or young women within the group, but mentors are beneficiaries. And if one adopts this perspective, it really helps to see what is needed to enable the effects to be sustained after the program ends. So the second type of sustainability I'm talking about is the sustainability of the effects after. What we've learned, next slide, please, about the first type of sustainability, we've heard a number of these general points echoed in the prior presentations. They need financial support, adequate training, job descriptions that are clear and feasible and stuck to. Cascade leadership is a tactic we have been testing and refining, whereby mentors can become supervisors, they have a career path, and also aspiring graduates of programs can become mentors themselves, which has an inbuilt sustainability function. And then we have heard very compellingly with the qualitative research how important emotional support is. These programs are often like opening a Pandora's box if the mentor is doing her job well, and they need regular, predictable support in order to stay in their roles. Next slide, please. In terms of sustaining the effects after the program ends, often mentors will continue to meet with groups of girls, sometimes with parents, in communities after the program, the external funding dries up. Of course, this is more likely to occur where mentors are local and they stay local and they have internalized the commitment. So these are not mentors who just see this as a job, but really that they have internalized the goal of empowering and protecting girls and young women in their communities. It's clear that they do require ongoing financial support, and there is a limit to how much these mentors can do. This has come in cases from community members or from governments, importantly, or sometimes international partners. They also benefit from structured opportunities, connections with other mentors, so they are not isolated, and so they can become part of a dynamic, growing movement that is much bigger than them alone. They also benefit from training opportunities, for example, to promote livelihoods, income generating opportunities. And by sustaining the effects of the program in the ways that I am sharing with you, that really visibilizes, makes visible a cadre of empowered young female leaders. And what this can do is to shift the notion of who is important within communities, within districts, if they're engaged at that level, and in some cases nationally. And it can really disrupt social norms about who has power, who can be a leader in their community, and creating this female infrastructure can sustain this and change social norms, and that's where you get true sustainability. We saw this play out under COVID, where in some contexts, mentors, former mentors were asked by community leaders to play a role in health promotion, in distributing PPE, for example. Very briefly on case studies, first a long-running population, next slide please. Long-running population council program in Guatemala called Abriendo Oportunidades, which means opening opportunities, which targets indigenous girls and young women. And this, as I mentioned, has been a long-running program. So there are groups of former mentors, alumni. Some of them have become certified tutors by the Ministry of Education who are providing formal training, for example, to out-of-school girls, and playing other roles like advising on curriculum development. Due to their reputation in some communities, mentors have been invited to participate in municipal councils. And then as alumni, mentors have actually created their own independent organizations. And another type of sustainability is that the model has been replicated and expanded in other countries in the regions, Belize and Mexico in particular. How did Abriendo Oportunidades get there? The tactics they used included the cascading leadership that I mentioned earlier, whereby group graduates become mentors themselves. They engage the government from the get-go, not just as a passive participant, but as an active, engaged collaborator throughout. And by doing this, they were able to really execute this long-term vision to strengthen the mentors' capacities in ways that are anchored to the communities, and then let them get on with it. So mentors had a lot of independence, have a lot of independence to do what they think makes sense. And these ex-mentors organizations that I mentioned have actually been successful at raising independent funds, thanks to the help of the Population Council and seed funding. Next slide, please. Very briefly, because I have 1 minute left, the Rwanda 12+ program is not a Pop Council program. It's a government program implemented by NGOs, you see on the slide here. And the Population Council did an assessment with the Rwandan Research Hub and identified opportunities to support those mentors who are continuing on their own steam. They requested badges, uniforms, stipends, a national network of mentors, so they could really become this sustained movement, links to other opportunities, as I discussed, income generating and fundraising for community activities. So there's a very rich opportunity to learn more about how to work with mentors after the program ends. Next, final slide, please. So in clothing, I've talked to you about how to sustain the tremendous potential of mentors in community-based group programming and encouraging the use of what is good practice, proven good practice on how to sustain mentors and programs. Unfortunately, as we have heard already, these are often overlooked, these good practice approaches. We need to explore more and address the untapped opportunities to sustain the effects of mentoring. I'll draw your attention to a toolkit the Population Council has that has been used throughout DREAMS and in many other initiatives, and the links on the slides that you will receive that really brings together a lot of this good practice guidance to help sustain the mentors as we have discussed here. And further questions, my email is there, and I thank you very much for your attention.
Thank you very much, Miriam. A key takeaway for me is that mentors are beneficiaries themselves and not just a means to an end. So thank you very much for that lesson, Miriam. Okay, so next up we have Alok Gangaramani from Final Mile Consulting. Alok is a behavioral scientist and design practitioner with over 15 years of experience in addressing complex social and business problems. Recently, he led a multidisciplinary program in South Africa that identified a novel way to segment high-risk AGYW based on their relationship goals and designed a highly effective behavioral change intervention to improve AGYW HIV prevention outcomes. Alok, over to you.
Thank you. Thank you for the introduction and inviting me here. I think our previous panelists have shared a lot of good perspectives from the mentor standpoint. What I thought I would do is share the other side, the side from the mentee in terms of what is she looking for, and then hopefully the two together can then help us develop a more human-centered mentorship program. Next slide, please. So what I wanted to cover is very quickly going through the kind of support that adolescent needs in terms of what is she looking for, getting a sense of who are her mentors in her natural environment, where is she getting the information from, and then what might be the implications of these learnings for mentorship programs. Next slide. And what I'm presenting is essentially a synthesis of our learnings from multiple countries where we engage with adolescent girls and young women in the context of HIV prevention, social and environmental vulnerability, RMNCH, economic empowerment, etc. Next slide. And very quickly want to acknowledge the time of my colleagues and friends in Kenya and Eswatini who are working with a lot of these youths and shared some valuable insights. Next slide, please. So yeah, so looking from the perspective of a mentee, right? So when we first engaged with adolescent girls, we were going in to understand the HIV prevention decision-making and journey. And what we realized very quickly was, that it's less about HIV, it's all about managing relationships. And it's a theme that has resonated in other areas, in other countries where we work with them. And often, and too often, most programs engage with them on a kind of a narrow set of objectives, and begin with some very intrusive questions around the sexual behavior, the sexual relationships, which one, of course, is intrusive, but two is also tends to become very irrelevant. So a clear implication, at least from a mentorship standpoint, is that we need to begin our discussions more focused on the goals that adolescents have, particularly the relationship goals. Next slide, please. Oh, sorry. Yeah, thanks. And if you just dive a little deeper into the relationship journey, right? And again, this is coming from our learnings from Kenya, but again, something that resonates in other parts, other countries as well. Is earlier adolescent period typically is characterized by a curiosity and experimentation phase, which can manifest in both positive and negative. But in the context we studied, it led to a lot more, early sexual debut, like you're talking about something as young as age 12, with sexual partners, and having, a lot of the narratives initially were, where the first sexual sex encounter was typically forced. So it kind of sets her down the path of vulnerability very, very early in her age group. Next slide, please. And as she gets older, you start seeing adolescents forming these kind of unhealthy relationships, where with poor mental models about keeping themselves safe or keeping avoiding pregnancy and so on and so forth. And that essentially also exposes her to things like being having sex with HIV positive men without the necessary protection. Next slide, please. And I think finally around the relationship is the fact that, even though relationship management is an overarching goal, these goals still differentiate, right? So when we were working in South Africa, we found these 3 different segments with very unique relationship goals within them. And essentially, again, the implication overall is that any program should not necessarily just focus on, should have like a one-size-fits-all strategy, simply because different girls will have different unique needs. And we need to think of how we can then develop our programs, both to see how her journey changes, but also within the journey, what might be the different pathways because of the different segments that we're working with. Next slide, please. So very quickly about looking at the, given all these unique needs and unique support needs that they have, right? How is she getting this information? Who is acting as her mentor in a very, very natural setting, right? And not surprisingly, peer groups tend to be the primary source of information, right? They tend to rely less on their family units or other institutions. And this peer knowledge essentially provides them the necessarily, so the social capital that they keep looking for. And I think that one of the most important point is that this peer network, is that the information is highly diffused, right? So there is no one mentor or one peer that acts as a mentor for a girl. This information is shared from multiple sources. In a way, girls become mentors for each other in a very natural setting. Next slide, please. And while this provides them the necessary social capital, it also leads to some counterproductive outcomes, right? So some of these, the same network that they have can then help them find men or other sexual relationships that could, that are looking for transactional sex or unprotected sex, etc., right? So this agency and this capital can essentially also become a source of vulnerability from an adolescent standpoint. And therefore, when we're looking at mentorship programs, we need to keep this in mind in terms of how do we work with this network that is also leading to this kind of a vulnerability path. Next slide, please. So, but at the same time, while we talked about these counter outcomes, we also saw a lot of positive outcomes, right? So while we were working in Tanzania, we met these young women who essentially, had ran their own businesses, but were in relationships that were keeping them relatively safe, and they almost acted as role models in the community, right? And they kind of depicted a vision of, how can certain values like self-efficacy or self-reliance be sustained. So as part of this work, what we did, we actually worked with them, with these women, as well as with adolescent girls and young women in the community, to develop this kind of a mentorship framework that can help impart these same values that these women have onto the rest of the community and the rest of the adolescent girls. Next slide, please. And a similar example, a slightly different example from South Africa, and I think this links to the point that Miriam was making, right? That we were running this kind of a group workshop, again focused on helping adolescent girls with their relationships. And even though this was not part of our design, we saw a sense of sisterhood that was created within the group of participants, right? They became each other confidants. They started helping each other, kind of mentoring each other in terms of how to deal with their boyfriends, negotiating sex, order prep, etc., right? So you saw this kind of sisterhood being formed in a very natural setting, even though it's not something that we were looking to do. Next slide, please. So just very quickly to kind of conclude and look at the implications for mentorship programs, right? So we can think of these mentorship programs as one that is trying to mimic this natural setting, this natural kind of relationships, right? So something which is more like a sisterhood or a female friendship model, because that seems to be very close to what they're actually experiencing. It's something that can be then also co-designed, like just like we did in Tanzania, right? You can co-design these kind of programs with both the mentors and adolescents together, given that both are participating in this together, and realize that all adolescents are not the same, which means that we should think of how we can integrate things like segmentation within these kind of programs to customize it for the different goals that adolescents have. And the other point is that, while there are important activities that most programs focus on in terms of, mentors helping mentees to, link with services, link with access to services and provide safe spaces, we should also think of something that is a little more value-based, right? So if you think from a long-term sustainability, certain values like self-reliance, like self-agency and other things, those are the values that you want them to be in part. So programs that can go a step higher beyond these activities, I think, can have a significant impact. And finally, as I said, that the journey of adolescents, they keep changing, right? So their needs change, whether it's education today, it could be health tomorrow, it could be business or job opportunities. So just like we have mentors supporting multiple mentees, we should also think of having mentees having access to many other mentors so that they can go to as their kind of needs changes. So yeah, thank you for listening and look forward to any questions.
Thank you very much, Alok. I think your application of psychographic segmentation is very fascinating. So thanks for that. So we're just going to make a quick adjustment to our agenda. So instead of taking 2 Q&A sessions, we're going to have one longer Q&A session at the end. So we want to give our presenters some time, a chance to complete all the presentations before we get into the Q&A. So with that being said, next up on the agenda, who will be bringing in our second group of presentations is Erica Kaginga. So Erica is the Dreams Program Coordinator at Tumaini Community Service Organization, which is supported by PEPFAR through Henry Jackson Foundation and Medical Research Institution. Erica is very passionate about working with AGYW because it gives her an opportunity to build their self-esteem, self-confidence, and lead them to reach their full potential. So please, Erica, go ahead.
Hello, everyone. My name is Erica Kaginga. I'm working with Tumaini Community Services Organization as a Dreams Coordinator, and we receive funds from PEPFAR through HGFMRI, like Adjoa said. And this is our mentoring program best practice. So we are reaching adolescent girls and young women aged 15 to 24 who are at the risk of acquiring HIV in Mbewe region in Tanzania. And we implement the Dreams program in 3 districts of Mbewe region. And we are implementing the program in collaboration with the ACE facilities, which are found in our respective councils. Next slide. Yeah, and this is our program structure. We have peer educator, total number of 164. Also, we have 27 mentors, and because of geographical challenges, we have placed these mentors into specific zones with a number of words, maximum from 7 to 8 words, because it depends on geographical challenge. But also, these mentors supervise peer educators, and they supervise a maximum of 7 to 8 peer educators. Also depends on the geographical location. Also, we have 12 field officers, we have 3 MNEs, and we have 3 coordinators from both 3 councils. Next slide. Yeah, based on the survey conducted by OGAC in FY20, we adapted the new mentoring program toolkit, and we used it for recruiting, orienting, and training of mentors. Before FY22, we used to have 11 mentors, but in FY22, we recruited 16 more mentors and makes the total of 27 mentors. All these mentors plus the staff were trained for 10 days on the new mentoring program toolkit. And they were training on the roles and responsibilities in the program. Also, they were trained on how to facilitate sessions in safe space with age-wise. They were trained on coaching techniques, but also they were capacitated on other aspects such as HIV prevention in general, the GBV prevention, and also the reproductive, sexual reproductive health. Next slide. Yeah, and these are our mentorship best practice. Here is a list, but in the next slide, I'll be explaining one by one. So you can just go to the next slide. Yeah, the first best practice from our side is high engagement of AGY into the program, because mentors and peer educators, they are enrolling AGYs into the program, but also they formulate groups. And currently we have 356 groups, but also they identify safe space for conducting those sessions. But also mentors assist AGY groups in registration to become legal entities, but also they run those safe space by providing the education, the HIV, GBV prevention, financial literacy, parenting skills, entrepreneurship skills, and also they run the saving groups because those AGY have saving groups. Next slide. Yeah, this is the second best practice. Because of mentorship program, it has led to the increase of AGYs who access biomedical services. Because in our program, mentors and peer educators, they are attached to health facilities for identification, because we have AGYs who go directly to health facilities, but those AGYs have criteria for joining the program. So while mentors and peer educators are in those health facilities, it's very easy to link those AGY into community for other services which are not provided at the health facility. But also sometimes the mentors escort these AGYs for biomedical services. And sometimes mentors, they are organizing the provision of outreach, adolescent-friendly services at community safe space by inviting healthcare workers. As you can see in the picture, it was a healthcare worker in one of our safe space, and the mentor was assisting her in registration into family planning services. Next slide. Okay, another best practice is the increase of advocacy of government into the program. And this is one of our strategy for sustainability in case one day the program fades out. So currently we have received a loan from the government in our groups. For example, we have a group, two groups who received a total of 20 million, which is like, it's more like 8,000 USD. But also we have other two groups who received 8 million, which is equal to more than 3,000 USD. But also the government have been providing spaces for our AGY groups to run their business, and sometimes they provide them with safe space. Again, the government have been linking our AGYs into the other stakeholders who provide services which relate to dreams. For example, we had a training which was organized by the government through other stakeholders. It was about entrepreneurship, and our girls attended for free. But also we had another training, it was about the business planning, and also our girls attended for free, and it was a work of a mentor who initiated all this. For example, for the case of the loan, it was the mentor who assisted on the registration of the group. Mentor assisted the group on writing the business plan, also submitting the application to the government for the loan. Next slide. Yeah, also, in our program area, we have society with a very strong cultural limitation, like the Maasai and Skuma. So at first, it was very difficult for us to enroll girls from those communities. But through mentors, they set a meeting with the community elders from those communities, and they provide awareness on the aim of Dreams program. And finally, the elders were able to allow their girls to join in the program, because girls from those communities have criteria of being enrolled into Dreams program. Currently, we have 8 groups, and they are very active. They have their own economic strengthening activity, but also they attend sessions for other services like behavioral change and other services. Next slide. Yeah, so this is a picture. You can see in the middle, there's a mentor with a community elder from Maasai tribe. And this was one of the meeting where she was engaging them into DREAMS program. Next slide. Yeah, also mentorship program has led to the identification and increase of engagement of AGY sexual partners, because the mentors conducted the male characterization exercise, and they identified that AGY are engaged, they are sexually engaged with the boda, bajaji driver, the truck driver. Sometimes they engage with the fishermen. So as you can see, all of this group are people who are working in a mobile situation. So the mentors has to design the best ways to reach these groups. As you can see in the picture, it was a mentor with a group of AGY sexual partners, but also in the second picture, the mentors decided to go to the place where they are stationed, like the place where they are stationed, to conduct session, because it's very difficult to engage them or to conduct session with them like the way we are doing with AGYs. So all these efforts led to the linkage of them. Thank you very much. That was my time.
Thank you very much, Erica. I believe that the engagement and support from governments, the traditional leaders, and the male sexual partners was definitely a game changer. So thank you for that insight. Next up, we have Lute Mbewe. Lute is currently coordinating the Adolescent project in Chikankata district in Zambia. Lute has experience in programming, team building, professional development, strategic implementation, and organization development, collaboration. Lute has managed many of the Adolescent projects at RICAP in Zambia. Lute, over to you.
Okay, can you hear me? Okay. Good afternoon. Hello?
Hi, we can hear you. Please go ahead.
You can hear me clearly?
Yes.
Okay, thank you so much. All right, I'm Lute Mbewe. I'm representing Hiv Community Program, which is it's an organization which is based in Kafue district in Zambia, and it's funded by a lot of big institutions, and Global Fund is one of them. Now you can go to the next slide, please. Okay, so there are two projects that we were implementing under Global Fund. There's Adolescent Safer Sex and Teaching End. There's mainstreaming of adolescent sexual reproductive health, which is based in Chikankata. To achieve the goal for the Global Fund, Rice Community Aid Program implemented various interventions such as conducting in-school and out-of-school community-based HIV prevention initiatives. And we are using a package called Comprehensive Sexuality Education in implementing these programs, because this packet is not really the DREAMS packet, but it's similar because almost all the topics that are found in the DREAMS packet are the same topic that are found in Comprehensive Sexuality Education. And it's got segment 3. One of them, the first question, the first topics are centered on somebody's self-discovery, why you ask yourself, where am I? Then after that, you go on to the other sessions where you ask yourself to say, where am I going? When you reach the stage of where am I going, this one now look at planning for the future. What should I do for me to reach my goals? You have to set your goals and everything. Then we go to how am I going to get there? This is where now the initiatives that you have to, that an adolescent has to put in place so that they can reach the goals that they've set in where am I going. Can go to the next slide, please. Okay, so as recap, aside from working with a lot of partners such as the Ministry of Education, Ministry of Health, and different organizations, we work with adolescents and youths and young women and some men. Even as much as we focus more on adolescent girls and young women, we don't want to be biased, because we know to say that the male gender are also important in our communities, and they do contribute a lot, or they do contribute a lot in our communities. So if we're just going to be targeting women, what about the males? That is why even when we're training them as people who will be able to deliver this information to reproductive health and rights information to the other adolescents, we also include the males in there. So in this information in targets, so this 60, and in Chikagata we had 35.
Lute,
Next slide.
sorry
Next
to
slide.
jump in. I wonder if you can maybe turn off your video, because we are getting a lot of feedback and you're breaking up a bit.
Okay, I think it's because the network is bad here where I am. The network is not that good. All right. So training. We train 20 HIV community champions, such as teachers, headmen, church leaders, and other influential community icons who have experience in advocating for behavior change among the youth. It will be pointless to offer the adolescent skills and knowledge to the adolescents without involving the most important people in the communities. And these people who influence and advocate for behavior change, they play a big role in these projects that we conduct. So it was imperative to say that we are offering information and certain technical skills that will help keep behavior change is very important, because when people are able to change their behavior, it means to say that it will have a greater impact on the reduction of HIV rates in our communities. Then also engage traditional leaders. These are very important people because they greatly influence also especially issues to do with gender-based violence. The moment these are spearheading such vices, even the feedback from the community is so great. That is why in our activities, we engage traditional leaders and we're able to recognize the importance in our project. Next slide, please. Next slide. Slide. Thank you. aside from we're able to orient community create demand and access for HIV testing and sexual reproductive health services to adolescents, young women and youths in the community. So we trained 60 peer educators, which is a very good success. And we're using the sexual comprehensive sexuality education tools. And these same peer educators were also trained in reporting and collecting data. Then we're also through the provision of the services, the ones that the peer educators used to do, they're able to establish linkages services between the service users and the service providers. Service users are talking about the adolescents, young women, and youths, and then service providers talking about the Ministry of Education or maybe the Ministry of Health, and we're able to build that relationship between the adolescents and the service providers. Next slide, please. Next slide. Cheers. Okay, and the other thing we're able to provide on-site mentorship. We notice that we live in the world where knowledge is new every day, and because old practices they get to be improved as time goes by. So we're able to in doing our project implementations, we're able to provide on-site mentorship where we're able to identify gaps to say, okay, I think here they're not doing well. What we can do, we can provide mentorship in such and such a way. So we can talk about the technical mentorship as well as some soft skills which were being provided to the peer educators who are acting as mentors in our projects. Then we're able to conduct community dialogues. We understand to say there should be an understanding between the communities and the service provider. These community dialogues helped adolescents, young people, and young women raise issues that they're facing in the communities that they feel that the service providers are not paying attention to. Through the same community dialogues, we're able to build a consensus between the service providers and the adolescents, thus increasing the access to HIV testing services in clinics, and also people are able to freely access other services from clinics such as family planning and art drugs. Next slide, please. Okay, so GBV is an issue that affects every community, and because we know to say the community there are always such issues, we're able to train some people under gender-based violence, and they're able to create networks that were able to look at issues to do with GBV. Then I'll give a very good example. In Luangwa district, GBV is high because you find that parents, because of the kind of work that they do, if they're fish traders or maybe they're trying to find something, raise income, they'll move from their places and go somewhere else, leaving children alone at home, children who are not really being taken care of, especially girls who are vulnerable. People, even relatives, will just come abuse them. And the moment when those children want to come out, they say, no, you can't do this because these are your relatives. So such information, there isn't, so we will try
First to jump in, Lute, I'm sorry, we're quite over time now. Can you please just try and wrap it up? Okay. I hope this is your last slide because we do have a few other people. Thank you.
Okay, I think you can just, Okay, just to summarize everything. Okay, yes, it's my last slide. In order to reduce such occurrences in the communities, the people are trained and in a GBV so that they are able to know the correct channel to report such cases. And also by doing so, they're able to protect the girls and the young women who get to be abused in our communities. And this doesn't just look at young women and girls, even there's some young men and boys who get to be abused. And yes, I think that's all.
Sorry, apologies. Thank you very much, Lute. Yeah, it's definitely a very fascinating topic, interesting topic. And I mean, I think the passion of all the presenters is very well felt. I think that's probably why we've kind of gone over time. Colleagues, I know that we have hit our time, but I think that it would be useful. I see there are quite a few questions that came out, which means engagement was really high. In the interest of time, may I just ask that, may I just suggest that we rather just collate all the written Q&A, get our presenters to respond, and then we send the responses via email along with the recordings and the different resources and tools. If everyone is okay with that, then I would just want to hand over to Kaya Lewis Atkins from the Global Fund, who will be given the closing remarks. So just to introduce Kaya, Kaya is a Senior Technical Coordinator for Adolescent Girls and Young Women at the Global Fund and has provided incredible insights in a range of work conducted in this space. She was a member of several advisory committees, including the Presidential Advisory Committee on HIV/AIDS under the Clinton and Bush administrations. Kaya, I'm handing over to you now. Thank you.
Thank you. And I'm glad you stopped the introduction, because I said it's more important that we wrap things up here. What a wonderful session we've had today. And my experience before I was at the Global Fund doing adolescent girls and young women work, I was living in Zambia. So I'm giving a shout out to the Zambian colleagues in Kafue. I'm working in Luangwa. But one of the programs I helped run was a safe space for adolescent girls and young women in the Chawama area near Lusaka. And we had peers and mentors. It was a program that was actually funded through PEPFAR, and we worked closely with the DREAMS program. And I was actually a part of the team that helped to create the DREAMS program. So it was so fulfilling to hear about this layer, this intervention we have around mentors and digging into that more. And so I just wanted to say that hearing the different things today about how mentors can really connect with young women, how sometimes they're the only people the young women feel like they can talk to, and how important that is, as our colleague from the Final Mile was saying, to put this in the context of what each young girl, young woman or adolescent girl in her context, in her personality, and to be able to couch these issues around HIV and around gender-based violence in the midst of actually the things that are oftentimes the first thing on young women's minds, their relationships, their family, needing money or a job, and how important it is for us to think about how mentors can play that role and really spend time talking to young women about what is affecting them most. So then we're able to come in with messages on HIV prevention while they're in a receptive space. I also
Have we lost Kaya by any chance? Kaya, if you're there, we can't hear you or see you actually for that matter. Yeah, it appears that we have lost. Is she here? Okay, so I think we've lost Kaya officially, which is quite unfortunate. But we hope that she'll be able to join us at some point and give us her last parting shots. But bearing in mind that we are 8 minutes over time, I just want to just again reiterate our greatest thanks and appreciation to the Bill and Melinda Gates Foundation for funding this webinar, to all the different presenters and panelists who supported and provided their insights, and then to the very engaged audience and participants for your questions, comments, and recommendations. I think that this is just a start of many meaningful engagements going forward. So as I think Kerry has put in the comments, all of this information is going to be available via email in the next day or two. And I see Kaya's here. Kaya, did you want to try and wrap up then?
The only thing I wanted to say, I'm so sorry I got cut off. I just wanted to say that in thinking about the sustainability and how to really make mentors work well, thinking about overcoming some of those challenges, they're the same ones I saw in our program in Zambia: compensation, the proper training for mentors so that they're able to really do the jobs that they want and help address the various challenges. We heard the stories that young women come to them with. And so I won't keep you any longer, but I just want to say thank you for the work. I think there's so much more we can do. And I thought what was really interesting at the top of our session was how much being a mentor can do for the mentors themselves. And I think that's a wonderful way to think about how we can continue this, make it sustainable, and really help girls with HIV prevention and other risk factors. So thank you, and thanks for your patience.
All right, thank you, everyone. I appreciate, there we go. We have the results of our Mentimeter. So we can see the key words that have come out as it relates to what a mentor is in the AGYW HIV programming space. We see very strongly the words supporter, empowering, guide, patient, innovative, friend, leader, peer come in. And we will also share this obviously via email as well. So again, thank you so much. Thank you for, so much from the Genesis team. Thanks everyone for your participation and being so patient with us as well with all the various technical and difficulties. So hope to see you in the next one. Have a good day.